Good afternoon, everyone. I'm Dr. Abdul D. Khan, one of the senior orthopedic consultants and HOD in orthopedics in Apollo Hospitals, Visakhapatnam. I had been a consultant orthopedic surgeon in this hospital since the last 3.5 years. I have a lot of experience abroad. I was abroad for 18 years, 14 years of which I was in the UK and 4 years in the Middle East. I did my MRCS Glasgow, MRCS Edinburgh, and FRCS Trauma and Orthopedics, CCT in Trauma and Orthopedics in Liverpool, UK. I worked as a consultant orthopedic surgeon in Aintree University Hospital, Liverpool for a while before shifting to Middle East. I worked in the 1200 bedded JCI accredited Dalla Hospital there. I had been doing both elective and trauma orthopedics in Apollo Hospitals, Visakhapatnam. I do both primary and revision hips and knee arthroplasty, along with shoulder arthroplasty, ankle arthroplasty as well. I also do arthroscopy of the hip, knee, ankle, shoulder, elbow, and wrist. We are the only center in our state doing hip arthroscopy regularly because we need a different equipment for it. A 70-degree arthroscope. We also have a small joint arthroscope, both 2.7 and 1.9, by which we can do ankle, wrist, and elbow arthroscopy as well. We have been doing this since last 3.5 years with very good results. We are also one of the only center in our state doing bone marrow aspirate concentrate BMAC treatment regularly. As you all know, BMAC is a latest treatment for early stage arthroarthritis, and also it can be used for sports injuries as well in multiple cases of tendinitis and inflammations. Yeah? And they are known to have good short-term results, especially after the COVID. Many people have been getting femoral head avascular necrosis, for which if not treated, they end up needing total hip replacement earlier in their life. So by using the BMAC, which is bone marrow aspirate concentrate, we can prolong the life of the patient's native hips, and we can delay the total joint replacement as much as we can. The reason why it's important is because if we delay the primary joint replacement as much as we can, the need of needing further revision joint replacement in the far end of their life is going to be less. And the advantage of BMAC is that it can be repeated again after a year or so, and we can prolong the life of the native joints as much as we can. We've been also been the only center doing ankle, elbow, and wrist arthroscopies, and there are many problems locally in the region for which they're only being treated conservatively with analgesics and steroid injections and rest and brace. But by doing a therapeutic arthroscopy of the ankles, wrists, and elbows, we can deal with most of the problems. And also in some cases, we can insert the BMAC as well. And it also improves their quality of the life and prolongs the longevity of their joints as well. For anyone needing any advice or help in and problems like early stage knee osteoarthritis or any problems with avascular necrosis of the hip, which is secondary to the COVID and steroid treatment, they can all consult us at Apollo Hospitals, Visakhapatnam. We are available daytime in Apollo Health City, Arilova, and we also do clinics in Apollo Hospital, Ramnagar. Namaste.